Welcome. Today we're meeting with Jen Sumner. And Jen, I'm just going to go ahead and let you introduce yourself and uh, tell our audience what you do and give a little bit of background about yourself.
Yeah, thank you. I am a neuropsychologist. I work at a neurology clinic with several neurologists, and we focus on, in general, individuals with traumatic brain injury or those experiencing memory disorders that you might find in a dementia process. I have initial training in clinical psychology with specialty in neurosciences. So my PhD is clinical psychology, but I take an extra track in neurosciences, and my residency and fellowships have been in neuropsychology.
Awesome. So, how do you help your patients work through the kind of issues that they're dealing with? Whether it's traumatic brain injury or, someone experiencing memory loss or other neurological disorders.
The first thing I generally do is one, I'll receive a referral from a neurologist. And so patients have come in with some type of cognitive complaint. Maybe it's memory or attention. Some people notice language difficulties or visual spatial problems. And so the neurologist may have done imaging testing or looked at biomarkers, but they want to quantify a level of impairment. How do people look compared to their age matched peers? And sometimes a neurologist will want to define the diagnosis a little bit more succinctly and see if there are any other comorbidities. And so a patient may come to me and we would do a comprehensive neuropsychological evaluation. That entails a lengthy interview where I go through birth history to academic functioning, career functioning, social life, and medical history, psychological history, to really see if there's anything throughout their lives that may have contributed to some type of brain change. And from that interview, I move into a testing procedure. And testing batteries for a comprehensive evaluation are lengthy. They're about 3 to 6 hours, depending on what I hear in the interview. What do we really need to test? From the interview and the testing, I'm able to compare people's results to those of their age, sometimes their gender, sometimes their education. And I can determine, are they really doing okay? Or is there a level of impairment? In an ideal world, I would have a baseline assessment from when people were functioning just fine, but rarely is that the case.
Mhm.
I always encourage people, if you're able, just get one if you're feeling fine, so that if something happens later, you can compare it. Once I have those results, and if I see impairment, I often recommend cognitive training. With cognitive training, we can come up with strategies to compensate for areas of weakness. Some of those strategies might be external things like using alarm clocks or note taking. But really, I try to work on internal strategies. Are there ways to problem solve more efficiently? Are there tricks to remember information that they have learned? Are there more efficient ways to learn? Often I work with people once a week and then have them apply those strategies at home. It's very helpful if they have a support system, so we can work in tandem with maybe a spouse, a child, a parent, so that the patient can practice with those people and be cued by those people. And then once people are able to apply those compensatory strategies, they're able to function in a more meaningful way. Strategy training doesn't cure memory impairment or other cognitive issues, but it helps make those weaknesses less apparent. Then I often give other recommendations if somebody might need medication changes or physical therapy or speech pathology. There are many things people can do that they're not aware of that can slow the decline of memory changes or create a healthier lifestyle that can improve functioning. And so some people think, well, you know what, I'm already having brain decline. There's nothing I can do. When in reality, that's not true. There are still things you can do.
So, what are some of the things that you advise people to do to slow down the brain decline or to improve their brain health?
Yeah, I'm in general, first line treatment are lifestyle modifications. And sometimes people have been to their doctors for years hearing you need to exercise more, you need to eat well. And what I tell people is a lot of things that we learn that improve heart health are actually really good for the brain as well. One of the first things is exercise. You want to move your body. The American Medical Association recommends at minimum 150 minutes of aerobic exercise per week. When we're working with an older population or someone with maybe preclinical dementia, like a mild cognitive impairment, we definitely want to add strength training, balance, and flexibility to any aerobic type exercise. Not only do they work on different physical aspects of the body, but they directly work on different areas of the brain. And so you want to incorporate all three of those. And it can be more motivating for people if they realize it's not just helping their heart or their strength or weight loss, which motivates a
Mhm.
lot of people. It's actually helping cognitive functioning. It's nourishing the brain. It's creating more blood flow and oxygenation. It's strengthening what we call synaptic connections, the ways the neurons connect to each other. And so exercise is really key. Nutrition is another big one. There are foods that we can eat, which are called antioxidants, so they can reduce inflammation in the brain. We know that when the brain isn't nourished and doesn't receive the proper nutrients, that it affects brain flow, it affects how neurons are stimulated. And so we want to do things to nourish the brain and to decrease inflammation. One of the most recommended diets is the Mediterranean diet. We know that that contains food groups that are most nourishing. So, eating really good fats like avocados or olive oil or fatty fish. We want to eat whole grains, complex carbs, lots of fruits and vegetables of different colors and variety, nuts and seeds. One of the reasons why research has found that the Mediterranean diet is so healthy is there are lots of what we call blue zones in
Mhm.
European countries. And blue zones are areas where you have the most centenarians or people that live to 100 and more, and they're living a healthy lifestyle. And so scientists have gone into these countries in the Mediterranean to see what that diet is. And so adopting that can be very helpful. So, exercise, nutrition, and sleep. Sleep is huge. When we sleep, cerebrospinal fluid, that fluid around your brain, kind of washes out the brain and removes amyloid. That's a protein in the brain that is associated with Alzheimer's type dementia. And so we want to encourage not only quantity sleep, but quality sleep. As we age, sometimes we get less sleep than we want to. And there are things that we can do to improve sleep. And one of those is to establish good sleep hygiene. Essentially, those are the things that we do in the day and before bed that improve quality sleep. And there are several things. A couple of those are we don't want to exercise within 2 hours of going to bed. We don't want to have heavy meals at dinner. You want to stay off of electronics. Some people read in bed or watch TV in bed. The recommendation is that you only sleep or have sex in bed. Anything else conditions the mind to think, oh, my bed isn't just for sleeping, it's also for these other activities, and we don't want to do that. Exposure to light early in the morning is really helpful for sleep at night. Keeping caffeine to early morning and nothing generally past 11. Caffeine tends to stay in the body for about 12 hours, though that tapers throughout the day. So there are a number of things you can do for sleep. So exercise, nutrition, sleep. Another really big one is stress reduction. All of us experience acute stress, right? Something happens and that can be motivating, right? We need to take care of ourselves. Maybe there's a big work project or a family situation, and that's normal, and everybody experiences that. If it happens for a short time, that's fine. What's concerning is chronic stress. So if you're living at a heightened level of stress for a prolonged period of time, that leaves a chemical called cortisol at high levels in the brain. Again, an acute surge in cortisol is fine, but cortisol at high levels over a long period of time can be toxic, especially to an area of the brain called the hippocampus, which is largely responsible for memory. And so using stress reduction tools is really important. Those tools can be varied. Some people enjoy different things. Some people meditate, or they practice mindfulness, where you try to concentrate on the present moment and reduce judgment about that moment. Some people do yoga or go for walks, or somebody might enjoy, some tea on their porch, looking out at the sunset, whatever that might be. But it's really important to try to keep those stress levels low. When people have chronic stress and it's hard to navigate, therapy might be really helpful. A lot of therapists teach some great stress reduction tools.
What about
So,
breathing exercises? Is that
moving exercises,
no breathing exercises?
breathing exercises. Yeah, breathing is a form of mindfulness. There's a great simple breathing tool called box breathing, where you breathe into the count of 4, you hold for 4, breathe out for 4, hold for 4, and you repeat that box over a few minutes if you can sustain it that long. We want to make sure you're not hyperventilating, because that can increase anxiety and stress. So you want them to be slow, deep breaths. And that calms the autonomic nervous system, which can decrease stress. And so that's something nice, because you can do it at any time of the day, multiple times a day. So that's a really good suggestion.
Great.
Um,
What else?
Sorry, did you have a question?
No, I was just asking what other advice do you give?
Yes. So something that we found in research over the last decade that's really important is socialization. When we isolate ourselves, it's linked to decreased cognitive functioning. When we socialize, it's kind of like exercise for the brain. It requires problem solving, language skills, attention, memory for what's going on, and that is helping those synaptic connections. Studies have shown that this is especially important in men. So as we age, we want to make sure that we're continuing to socialize. And outside of our family dynamic, it's more challenging to socialize with friends and acquaintances than it is with family. Families often have like shorthand speak with each other, and so it's easier to talk. Whereas with friends, you have to navigate some of those nuances that are less familiar. It doesn't have to be quantity. Quality is really important. You want to establish relationships with people where it's easy to feel vulnerable, where you can share stressors, where you feel like you can laugh and it's enjoyable and not frustrating. So there are various ways to do this, because some people feel like it's hard to make friends if they haven't had a good friend group. And so I encourage people to volunteer. Find a place where other people are volunteering and you can start that relationship. Libraries have book clubs. Community centers have similar hobbies or interest groups. There's online forums like Meetup where people that like hiking can meet at a certain location and hike together. So there are ways to establish friendships that you might not already have. If you do, great. Meet up with friends more often, walk together, have lunch together, play a sport together, do puzzles together, whatever it is you like to do. The last area of what we call the pillars of brain health is novel stimulation. As we age, we tend to stop learning and challenging our brains. And that's the last thing we want to do. So engage in things that are new and challenging. The caveat is, as you're learning new things, you don't want them to be overly frustrating. If you're starting to get angry with what you're learning, it's not helpful, right? That kind of counteracts the learning process. So you might learn, you watch a YouTube video and you learn to sketch an apple if you've never done that. Maybe you explore a new town you've never been to. Some people are extreme and they want to learn a new instrument or a new language. Great, go for that. But that can be really intimidating. It can be as simple as learning a new board game or a new card game. Some people like crosswords or Sudoku, and those are great, but those also kind of are patterns of learning that are very familiar to the brain, like reading. People say, well, I read voraciously. Keep doing that, but your brain already knows how to read. You want to really expose yourself to something new. So in terms of brain health, focus on exercise, nutrition, sleep, stress reduction, socialization, and novel stimulation. Those things have been shown to either prolong the onset of a disease, slow the disease, or even prevent it. We know that overall, Alzheimer's disease starts about 15 years, sometimes 20 years before a diagnosis. And capturing, using these lifestyle skills as early as possible are going to give you the most bang for your buck later in life.
So, a couple of years ago, when I mentioned to you this, I might have mentioned this to you earlier. I was diagnosed with mild cognitive impairment, and they gave me this basically the same exact advice. And one of the things I said to him was like, "Well, I'm already doing a lot of these things," and their comment to me was, "That's great, keep doing them, but step it up a bit.
Yeah.
Doesn't have to be a lot, but like go to the gym more often, or make your workouts just a little bit harder. Improve your diet just a little bit more. Socialize just a little bit more." So sometimes it's kind of those increment changes for some people who are already doing those, and
Yes.
and I did a few other things too. But a year later, I went through the testing kind of that you talked about, and said, "Well, you don't have mild cognitive impairment anymore." And so I know these things can work, but what are your thoughts on, that situation where someone says, I'm already doing a lot of these things. Would you give that same kind of advice, or would you say something else?
I would definitely encourage people to step it up if they can, but also if somebody is experiencing mild cognitive impairment, or even if they're not there yet, I tell people it can also be beneficial to learn cognitive training strategies early. For instance, there might be some ways to encode information or bring information into your mind that are more efficient for recall later.
Yes.
If you learn those strategies before there's a problem, you will have created a habit that will be easier to apply when you do have a problem. Sometimes what happens is people will come in and they've already been diagnosed with maybe preclinical dementia or early dementia. It is much harder at that point to adopt these strategies because it's harder to remember what I'm teaching
Yeah.
them.
Yeah.
So, if interested, I tell people start strategy training early, adopt those habits now so they become routine. So, yes, step up the lifestyle factors if you can, add strategy training. Um, Teach these things to other people. We know that teaching consolidates information. Um, if in the opposite, people aren't doing these things and they're overwhelmed by overhauling their lifestyle, I encourage people to start with one thing. One thing makes a difference.
Yeah.
Some people that are opposed to exercise, I tell them movement makes a difference. If you simply start by walking around your block, that is increasing activity and it's beginning to start to nourish the brain. Some people don't participate in things because they think, well, I can't do it all the way, or I'm not going to do it right. And what I tell people is a little bit more is more than what you were doing before, and that's helping you.
Yeah.
So try not to be intimidated. Try not to feel like, well, I'm doing all that I can. And try not to feel like this is a sentence, like this is the sentence I have forever if you've been given a diagnosis.
Is there any other advice you would give someone who's concerned about their brain health?
I always tell people it doesn't hurt to meet with your doctor. So many people second guess and they think, is this age related? Is it not? Is there something going on in my life right now? And I say, if they can afford it, if they have insurance or they have money to pay out of pocket, it's not going to hurt to go to the neurologist. It's not going to hurt to visit with a neuropsychologist. Get that baseline testing, see if there is something that's out of the norm. And so you can have more tailored recommendations. Maybe it is age related, right? We all have changes in our brain, especially once we hit our 40s. We start to notice, I'm not remembering those words as much as I did, or it's a little slower to process information. There is very normal age related decline. But if you are starting to question things, explore it. Don't just kind of push it to the side because, like I said, with an Alzheimer's type dementia, things start 15 to 20 years before you get a diagnosis. There's something called vascular dementia, where that might come from a stroke. So it's very important to monitor cardiovascular functioning. So stay on top of those annual checkups, get the lab work, monitor diabetes, heart disease, hypertension, high cholesterol. There's another type of dementia called frontotemporal dementia. With that dementia, you tend to see behavioral changes before you see other cognitive changes like memory or language functioning. So if people are commenting that you're a little bit more impulsive than normal, or that you might seem inappropriate in how you behave or talk to other people, that's worth investigating. Another type of dementia might be a Parkinson's disease. So if you start to notice early on that maybe you're tripping more, or you don't feel as balanced as you were, or you're starting to have a small tremor, go to the doctor. It doesn't hurt to investigate things as early as possible. Some people feel like, oh, they're going to think I'm a hypochondriac or I'm overly worried. Who cares, right? Like, go get it checked out. And if you still feel like there's something they're missing, get a second opinion. Then at least you'll know, right? I'm okay. I'm doing fine. I don't have to worry so much about this. So I think, my added advice is trust your gut, explore, investigate.
I love that. Um, you know, I went to a neurologist as well, and that was great. In fact, it took a little bit of effort to find the right neurologist.
Yeah, definitely.
Because the first one I went to wasn't really very helpful, and the second one was great though. It was very proactive. Another thing I did, and I'd love to hear your opinion on this. I also have gone to a nurse practitioner
Mhm.
that specializes in integrative health, more. Um, I, I I don't know how to explain it, but more natural ways. What are your thoughts on that?
NPs are great. They often have more time with the patient than an MD might. So I'm all about that. I would make sure someone specializes in cognitive um, concerns. That's really important. I also find that, we can integrate Eastern medicine approaches into our Western medicine. That might be something like acupuncture. It might be using different supplements. There might not be as much evidence based research behind it, but that doesn't mean it can't be effective. So, people that have the resources, I suggest doing it, right? You want to make sure you find a provider that does have training and expertise in what they're doing. I would get referrals from people where you can, but don't be afraid to try various approaches. The only caveat to that is you want to make sure you're not dabbling in something that could be dangerous. So I
Okay.
tell people research. One of the best research sites is called PubMed. They look through peer-reviewed journal articles to tell you what, current research or past research has um, suggested or found from different studies. So, you know, be your own advocate. Do the investigation. Don't rule out things that might not be just familiar in our Western culture. Obviously, I have training in Western medicine, and that is where I come from. I come from a very big research focus. I worked in clinical research for about 15 years before I transitioned to full clinical practice. And so I am a big proponent of evidence-based approaches, but I don't rule out naturopathy or meeting with a DO versus an MD. Find what works for you because you'll be more motivated to apply the suggestions. Um, it's really important that you buy in to any intervention because if you're resistant and you don't want to do it, it's less likely that you'll apply the strategies that you need for overall health.
Are there any supplements that you would recommend, or would you tell people just to research that on their own?
Yeah,
Um,
I mean there are mixed findings so
yeah.
far, supplements and what work. I tell people if they want to go the supplement route, meet with a nutritionist.
Okay.
See what would work with their bodies, what works with their diet. In general, we want to feed ourselves with what we eat more than supplements. Supplements often aren't digested in the body the same way as food. But there have been some supplements with positive findings. Like I say, results are mixed, but I tend not to give recommendations for supplements for various reasons. I always, in my recommendations, if the patient is interested in that, I tell them to meet with a nutritionist.
Awesome. You've given me so much great information. This has been wonderful. I just have one last question for you. Um, and this maybe will seem a little bit off the wall, but tell me, what role does faith or your belief system um, play in what you do? How does it impact your work? How does it impact your life and impact how you work with patients?
Yeah, I think that's twofold. I think one is as I've studied the brain, it has opened my mind to how pivotal it is to have kind of a divine creator, that our brains are so intricate and involved in who we are that the organizational level of the brain for me has to come from, a divine creator. There's nothing happenstance about the brain. And so I think in the first place, I realize what, this intricate, amazing organ does for us. And then the second part of that is treatment and how I work with patients, because people suffering from cognitive decline are often they often feel helpless or hopeless. And I try to empower people where I can. And a lot of that comes from gratitude, focusing on the gifts that they have that they can use, trying to focus on resources outside of medical providers. And that resource might be faith, might be turning towards more of a spirituality, especially in reducing the stressors, recognizing that there is kind of more to what we're experiencing than the tunnel vision of a disease. I definitely, in medical practice and where I am, try to turn that over to the patient to find that within themselves, as opposed to directly, advising in terms of, this is a way you can turn to God. But there has been a plethora of research showing that gratitude affects mood, which affects cognitive functioning, and looking towards our blessings. And spirituality has been shown to improve mood and functioning. So I think faith is an underlying component of all of this, and can help the process of healing and managing a disease and motivating us, and really helping to improve our day-to-day functioning where possible.
That is so awesome. If people want to find out more about this, can they contact your clinic, or what would you
Yeah.
recommend them? What's the best way to contact your clinic or get more information?
Mhm. So I work in San Diego, California,
Okay.
at Kaizen Brain Center. Because of licensing laws, I can only provide treatment to people that live in California.
Okay.
However, I also provide coaching. And with cognitive coaching, it's more of an educational platform, and I can do that anywhere. I have worked with people internationally, nationally, and instead of being a patient, a person is a client. And like I said, it is more of kind of a teacher student or an interactive relationship. I do not work with any type of associated depression or anxiety. I do work with stress reduction, because that's an
Hmm.
important part of cognitive functioning. So if people are interested in cognitive coaching, they can still reach out to my clinic. If they live in California and they want to work more on associated emotional issues or more in-depth interactive medical interventions, then I can also do that. If they live far from San Diego, I do work with people virtually. That's become a big part of my practice since COVID. So there are various ways that I work with people, and the best way is to just contact my clinic. And I'm sure you can list some of that information in your newsletter.
There an email address that
Yes. So I can just give it to you now. It's
okay.
Sumner. Sumner is spelled SUM as in Mary, N as in Nancy, ER, at Kaizen Brain Center. And Kaizen is spelled KAIZEN, kaizenbraincenter.com. And Kaizen is actually a Japanese word for continual improvement. And so that is what we're trying to help people with as they come to our clinic.
Awesome. Thank you so much for taking time with me today. This has been great. I really appreciate